Here is a case of infant with large volume cystine stones, bilateral large volume stones. In fact, underestimated on ultrasound. Right side we have done PCNL because post-stent access sheath could not go. Left side we are showing this video where we could pass the access sheath. And one more thing, we are using the smallest length access sheath 40 centimeters and the smallest diameter flexible scope 6.3 French from Hugemed. No conflicts of interest. At the moment in India, 2 companies are producing such type of scopes. So here is a case of infant fans RIRS with shortest fan sheath of 30 centimeters from Biored and shortest flexible scope Hugemed 6.3 French. First step is almost 14 months. Right side is over, cleared completely with PCNL supine. Left side, we thought it is a small volume stone on ultrasound. Again, being a infant and children RIRS surgeon, I feel I can do less invasive work with RIRS. It is technically demanding. I pass 2 guide wires always in children with merge maneuver, 1.018 and 1.025. One I use for the access sheath, another I use for the safety guide wire. The safety guide wire is mainly to avoid the kink in the ureter. When I pass the access sheath this time, this 30 centimeter access sheath is going now slowly. This is the smallest sheath available. This is the 30 centimeter access sheath slowly going into the kidney. And when it crosses the pelvis with little resistance. But if you see here, only the obturator tip has gone but not the access sheath tip. That is the most dangerous part in the infants and children, small children. When I went inside, it was just below the PUJ. So with my experience, I threaded carefully, very carefully. Multiple stones are seen. I was doubting whether this is a very small scope. Sheath is short distance. Very advantageous in this case. Water logistics were good. 9.5 French sheath. 9.5 and 30 centimeter. Water was immediately coming out without section. Then I thought it is no harm in doing. See, I am not sucking, still the stones are at the mouth of the access sheath. That is the beauty of match between the scope and the lumen of the sheath. If it is 3 French, it will be very nice. See, every dust is coming out. Chances of sepsis will be less. I say it is technically demanding. So all the movements are everything like fans. But when I am sucking out, they are coming out very fast out. 50 centimeters versus 30 centimeters. 30 centimeter length is very short. So see, when I am coming out, quickly it is coming out. Even this length is also more. But that is minimum. This is looking like PCNL for me, where you are taking out the fragment. The only concern is PUJ. If you cross PUJ safely, if you don't come out of the PUJ again and again, if the scope movements are good, it's very good surgery, no doubt about it. We have done a lot of pediatric and infant surgeries. With that experience only, these should be attempted. Again and again we caution in my videos that casually you should not attempt in your 10th case or 15th case in a large volume. See, inferior calyx. The stone in fact basketed. I used basket and then kept it above. Sometimes baskets are required. You cannot say that basket is not at all used. You need 3 people, I always say in fans. 1 person who is flushing, preferably senior most, and this is the basket. This basket also went easily in the 6.3 French scope. That is the beauty of 3.6 French channel in this. Now, one time it has come out and slowly I have threaded up PUJ. I was really afraid. In the entire surgery, I have not come out of the PUJ. If you come out, repeat, see, a small out of PUJ causes little bleeding. And these are all very important steps where if you come out of the PUJ, reinsertion, then bleeding, then lack of vision, all this makes intrarenal pressure increased and chances of sepsis. So Dear urologists, do not attempt in infants and children casually, but after doing 100 cases, see, this is a deep inferior calyx with sheath, with RGP, completely cleared. I never thought these stones are cleared in 48 minutes. I am showing on the screen, it is 48 minutes on the screen. I put the stent directly through the access sheath. Access sheath usually comes out of the PUJ. The person who is holding at the PUJ is very, very important. The person flushing the water as well as holding at the PUJ, both are important. Ultimately, I did the case successfully with 8 stones. This is a large amount of the powder drain. And next day morning, I was feeding the child with a sweet, and he was happy to take and went on the post-op day 1. All the patients may not be like this. These are all positive surgeries we show. Some amount of fever, staying for 5-6 days also happen with children. So never discharge early if they are looking sick or having fever or CRP is more. Thank you.